This medication does way more than most people think. Originally developed to treat seizures, now it has been more commonly prescribed for nerve-related conditions, and it works by calming the overactive nerves in the brain and the spinal cord. And although it looks similar to the gamma aminobutyric acid or GABA, which is a calming chemical in the brain, it doesn't actually work on the GABA receptors. Whoa. Instead, it binds to the specific calcium channels to reduce the nerve pain and abnormal electrical activity. Hi, my name is Stan, and I'm a licensed pharmacist passionate about helping people understand their medications. And yes, today we're talking about gabapentin, also known by its brand name as Neurontin. Some of the most common FDA-approved uses include nerve pain for conditions like diabetic neuropathy or shingles, partial seizures, and restless leg syndrome. It's also prescribed off-label for anxiety, migraines, fibromyalgia, and even hot flashes. It's a versatile medication that help many people manage tough chronic conditions. Typical dosages vary depending on the condition being treated. For nerve pain or seizures, people often start with 300 mg once a day and then gradually increase. A common maintenance dose is 300 to 600 milligrams 3 times a day, and the maximum daily dose is 3,600 mg, which is divided into 3 doses. And your provider will tailor the dose based on your response and any side effects. Gabapentin can be taken with or without food, but bedtime is often the best time to start, especially for new users. Since one of the most common side effects is drowsiness, taking the first dose at night can help your body adjust while minimizing daytime fatigue. As the dose increases, it may be taken multiple times throughout the day, but it's still a good idea to keep one of those doses at night. And speaking of the side effects, some of the most common ones include drowsiness, dizziness, fatigue, swelling in the hands or feet, double vision, or weight gain. It's a good idea to avoid driving or operating heavy machinery while you take this medication until you know how it affects you. And even though gabapentin isn't a federally controlled substance, some states have placed additional restrictions due to concerns about misuse or dependency when combined with opioids or benzodiazepines, since gabapentin does have potentiating properties. It's important to not stop gabapentin suddenly, especially if you've been on it for a while, as stopping abruptly can lead to withdrawal symptoms and even seizures if you're taking it for seizures. So always talk to your provider about tapering off safely. Well, that's a quick rundown on gabapentin. If you found this helpful, like, subscribe, and drop your questions in the comments. Remember, this video is for educational purposes only. Stay healthy, and I'll see you next time.